and you can see the internal carotid artery right there. So as you can see over here, this is the cervical part. It's entering into the base of skull and becoming the petrous part of the temporal bone. So cervical C1, this is the petrous part C2, this is the foramen laceral part, and as you can see, a lot of curves. This is the carotid siphon, which is the cavernous part, which is in the sphenoid level. Okay, so this is the C1, this is the C1. It enters the skull base, becomes the petrous part. This becomes the foramen laceral part. This entire thing is a siphon, which is the sphenoidal part. That's the cavernous carotid. As soon as you go up, that's the clinoidal, that's the supraclinoidal, and as you can see the ophthalmic artery arising from here very clearly. That's the ophthalmic artery which is arising, and that is the ophthalmic part of the ICA. As you go up, you can see the anterior cerebral artery, and this is the middle cerebral artery. So as you can see over here, right, that's the anterior cerebral artery over here, you can see, and that's the middle cerebral artery. Now, the anterior cerebral artery has 5 parts: A1, A2, A3, A4, A5. The A1 is nothing but from the internal carotid artery up to the ACOM. So you can see over here, somewhere this is the A1. Then the A2 is from the ACOM level up to the bifurcation of the calloso-marginal and the pericallosal artery. So you can see somewhere around here, you can see the corpus callosum, and this branch which you can see over here is the pericallosal branch. This is a pericallosal branch, and somewhere around here you can see the calloso-marginal branch in the gyrus. Okay, so this is the A3. The pericallosal branch is the A3 branch, and this is a corpus callosum in the center. So the genu of the corpus callosum is A3, and in the body of the corpus callosum, anterior half is the A4 segment of the anterior cerebral artery, and the posterior part corresponds to the A5 segment. So these are how the segments are formed. Okay, so this is the real-time arteriography as you can achieve. Now normally the arteriography is done to check whether there is any feeder which is given off to the juvenile nasopharyngeal angiofibroma in cases of intracranial tumors where they can have a blood supply from the internal carotid artery. So that's the sole reason you do an arteriography, to check the anatomy and the feeding status of the tumor. So you can see clearly the ophthalmic artery, the A1, A2, A3, A4, A5, the MCA, and each and every segment of the carotid artery very clearly in a real-time arteriography. So that was the arteriography for you guys. The second thing, now this is the same picture of the arteriography as you can see over here. Now I just showed you the real-time arteriography, and you can cross-check over here. This was the C1 segment, that's the C2 petrous part, that's the foramen laceral part. Now that's the cavernous part, that's the that's the clinoidal, the ophthalmic. As you can see over here, that's the ophthalmic artery right there. That's the ophthalmic artery. You can see the C7 part. You can see the C7 part over here, and that's the ACA and the MCA part over here. So that is how you divide the artery on an arteriography. The same thing over here, we can see this is the ophthalmic artery coming here. This is the inferior lateral trunk of the cavernous sinus part. That's the meningohypophyseal trunk, which I explained you some time back. That's the posterior communicating artery, which is a branch of the C7 actually. This is ophthalmic artery, which is a branch of the C6. And as you can see over here, that's the anterior cerebral artery. That's the middle cerebral artery over here. That's the posterior cerebral artery. Okay. So this is also about the arteriography. Now, this is the yet another photograph of the arteriography showing the divisions of the internal carotid artery. I hope this is made very easy for you guys now if you watch this video few times again and again, so you will have all the basics clear in your mind. This is also yet another photograph of the ophthalmic artery right there. That's the anterior cerebral artery. Now remember, the anterior cerebral artery, they go upwards and anterior and then suddenly divide and branches off posteriorly along the corpus callosum to form the A3, A4 and A5. This is the MCA. The MCA divides into M1, M2, M3 and M4. Now I'll make a separate video explaining in detail for the neurosurgeons and the skull base surgeons in detail about the ACA and the MCA. Okay, so next thing is, this is also yet another photograph of the arteriography. So I hope you can take a screenshot of this photograph and you can just access the various branches. As you can see over here, that's the orbitofrontal branch, that's the pericallosal, that's the prefrontal. You can see this is a callosomarginal, that's the callosomarginal being divided at the level of the A3. This is the A3, this is the A4, and this is the A5 over here. So pericallosal, the callosomarginal, the frontopolar, and the anterior cerebral artery right there. And you can see over here, this is the middle cerebral artery, the 4 branches, M1, M2, M3, M4. And that's the anterior choroidal artery. That's the ophthalmic artery over there. Yep, that's the ophthalmic artery right there. So it's very easy to localize the ophthalmic artery on a scan. So that's the ophthalmic artery. This is a very important photograph, so I hope you take a screenshot and read that at your ease. So moving on to the next thing is a rough photograph. It's the same thing. You can also take a screenshot of this photograph right here. Okay, so this is very important for an MBBS student, a skull base surgeon, and a neurosurgeon. Okay, so that was the second point saying regarding the arteriography. Okay, now we move on to the third point, which is the MRI. So I will show you few MRIs of the patient, and I will in short show you how you can actually trace the internal carotid artery right there. Okay, so let me show you this one. Okay, so yeah, that's the coronal section and this is the axial section. Yes, this is a perfect MRI. Okay, so to study the internal carotid artery on an MRI scan, we first need to understand the posterior circular villus, that is the vertebral arteries forming the basilar artery and terminating into the superior cerebellar and the posterior cerebral artery. Now, if you haven't seen how a circular villus is formed or in detail, if you want to read about it, go check out my other video where I've explained in my own simpler version of how you can understand the circular villus. So do check that video out. So the vertebral arteries from both the sides, they unite to form the basilar artery, and the basilar artery terminates into the corresponding posterior cerebral and the superior cerebellar artery. Okay, so the vertebral, this is a right vertebral, you can see over here as a flow void. Okay, so any artery will be appearing as a flow void on an MRI scan until and unless it's a non-superimposed scan where you can see the arteries as illuminating with the post contrast. But this here, you can see it's not illuminating, it's a flow void because of the high velocity. So this is a vertebral artery right there, right and the left. As you keep on going up, you can see a faint branching of the vertebral artery giving off the posterior inferior cerebellar artery, that's called as the pica. So if you keep on going up, you can see this vertebral arteries on both sides uniting to form one common basilar artery. Now that's the basilar artery right there. Now, as we all know, the basilar artery just above, the two vertebral arteries, when they form the basilar artery, just above it gives the branch called as the anterior inferior cerebellar artery. So you can clearly see the branching right here. This is nothing but the anterior inferior cerebellar artery. So further on, if you keep on going up, you can encounter the pons area here, and you can see multiple pontine branches occurring from the basilar artery right there. So soon enough, you will see that this basilar artery single flow void will divide into two flow voids. That is nothing but that is the posterior cerebral artery, and just before that you will see two branches right here like this. Wait, I'll show you in some time. You see that it's a very faint branching. You can see that's a very faint branching right there. See, still it is the basilar artery. It has not divided into two separate posterior cerebral arteries. So you can still see one single basilar artery and branching at either side. This is nothing but the superior cerebellar artery. Okay, that's the superior cerebellar artery. So we saw the pica, ICA, and the superior cerebellar artery. Now this is a superior cerebellar. Now if we keep on going above, we keep on going above. Okay, so we keep on going above. After the superior cerebellar artery, we can see this basilar artery. See that? Dividing into two. See, this basilar artery got divided into two holes now, so two flow voids. That is nothing but the termination of the basilar artery into the posterior cerebral artery. Okay, so if you keep on going above further, now you can start seeing the posterior communicating artery. You can start seeing the posterior cerebral and the posterior communicating artery, and what you can see over here is the internal carotid artery. This is the orbital apex. This is the area of the sphenoid sinus, the cavernous sinus, and this is the internal carotid artery. So once again, I'll show you. That was a basilar artery. These two branches were the superior cerebellar artery. Further up behind, we can start seeing the posterior communicating artery right there, and we can see the posterior cerebral artery right here. This is the posterior community. This is the internal carotid artery. You can see very clearly. That's the internal carotid artery. Okay, and this is what you see is the posterior communicating artery, and this is what we could see is the posterior cerebral artery. See, this was the basilar artery, this was the posterior cerebellar, this is a posterior communicating, this is the internal carotid. See how they are connected. This is being connected. This is a posterior communicating, this is a posterior cerebral artery, this is a posterior cerebral, posterior communicating artery, and that's the internal carotid artery right there, and that's the orbital apex, that's the sphenoid sinus area. So as you keep on going further above, now this is an axial section. We are going from the lower to the superior surface, so we are going above, and we can see this is the internal carotid artery right there. We can see the optic nerve, we can see the globe. This is a T2 scan over here. This is a medial rectus, lateral rectus, orbital fat over here, the sphenoid sinus, the posterior ethmoids, and all. You can see clearly this is the internal carotid artery. That's the internal carotid artery. If you keep on going above, you can start seeing the optic nerve. You can start seeing the optic chiasm being formed. Now that's the optic chiasm. That is still the internal carotid artery. Okay, that's the optic nerve. And as we saw sometime back, the photograph, we could see the optic nerve, right? And above the optic nerve and just behind the level of the optic nerve, the internal carotid artery divides into MCA and the ACA. So just pay close attention right here. We have already reached the level of the optic chiasm and the optic nerve. So somewhere around here, the internal carotid artery will start dividing into two. Okay, so as you can see over here, this is the very point where this is the internal, see, just follow this internal carotid. This is the internal carotid, this is the internal carotid. If we go slowly above, this is the optic chiasm, the level of the optic nerve. So somewhere around here, the internal carotid artery should divide, and we can already start seeing the middle cerebral artery on both sides, and this is nothing but the Sylvian fissure. That's the Sylvian fissure, and in which the MCA is always found. And you can also start seeing the anterior communicating artery right here. As you can see, that's the anterior communicating artery, that's the A1, that's the A2. So that's the internal carotid artery, which we will see dividing in some time. As you can see over here, that was the internal carotid artery dividing and terminating into the MCA. You can see that was the internal carotid, see, internal carotid, then dividing into the MCA, into the Sylvian fissure, and this is the anterior cerebral artery A1, and this is the ACOM, that is the anterior communicating artery, and this is the A2. Similarly, we can see the MCA. From here we can see the MCA in the Sylvian fissure, that's the A1, that's the ACOM, and that's the A2. So if we keep on going further above, we can see the two anterior cerebral arteries. Now I have shown you in previous photographs, that The anterior cerebral artery, if viewed from the lateral aspect, see on the sketch over here, see, this is the lateral aspect, this is the anterior cerebral artery going above in the superior aspect. As you can see over here also, the anterior cerebral artery goes above in a vertical direction, and the middle cerebral goes in a lateral direction in the Sylvian fissure. So similarly, we saw over here that the cerebral artery, anterior cerebrals are going up in vertical direction, and we could see the MCA going laterally into the Sylvian fissure and then disappearing, okay? And we can see only the ACAs, the two ACAs as two flow voids. And now, if you look carefully, these two ACAs will start dividing into their respective branches. Okay, so they vanish off into the brain parenchyma as their A3, A4, A5, and recurrent artery of Hübner and all. So one most important thing we should also look for is the ophthalmic artery. Now this is for the ophthalmic surgeons by any chance. If you are at all watching this video, for ophthalmic surgeons, you should know that the ophthalmic artery is a branch of the ICA. As I showed you here, that's the ophthalmic artery right there. So this was the ophthalmic artery coming off from the internal carotid right at the level of the pituitary gland and the optic nerve. So I'll show you that same ophthalmic artery as well. So here, see, this is the internal carotid artery. This is the internal carotid artery. You can see this is the ophthalmic artery. See, clearly it is arising as I showed you. See, this is a medial aspect, and then it is going laterally and then coming off medially again. Similarly, we can see the ophthalmic artery right here. This is the internal carotid artery. Similarly, this is the ICA, this is the ICA, and you can clearly see this is the ophthalmic artery. Same consistency, same contrast. So this is the ophthalmic artery. See, it is coming from a faint origin, is coming from the ICA, and that's the ophthalmic artery going in. See, similarly, I showed you here, that's the ophthalmic artery. This is a medial aspect. It arises superior medially and then travels laterally. Similarly, we can see the same thing happening over here. This is arising medially and then going laterally. So this is the ophthalmic artery. So this is how we can trace the ophthalmic artery, and that same ophthalmic artery then enters inside. You can see that that's the ophthalmic artery right there, from medial to the lateral aspect, and then again it turns out to come as medially to give off branches like supraorbital and supraorbital artery. Okay, supraorbital artery, and then this same ophthalmic artery gives rise to the anterior ethmoidal and the posterior ethmoidal arteries. Okay, so that is the ophthalmic artery. You can see very clearly it's originating from here, and then it is seen over here as well, as you seen over here as well. So this is how you trace the entire internal carotid artery on an axial scan. Now if the question arises for a coronal section, then the coronal section is also see, the easy trick for locating the ICA on the coronal section is that you first go at the level of the sphenoid sinus. Okay, you go at the level of sphenoid sinus. See, this is the level of sphenoid sinus. You go posteriorly, you keep on going posteriorly until you start seeing the cavernous sinus. Now to locate the cavernous sinus, on the cavernous sinus post contrast or on T2 will flare up. Okay, all you can see, this is a CSF, that's the lateral ventricle. This is all the area of the cavernous sinus. If I zoom this for you guys, that's the area of the sphenoid sinus. See, this is the area of, this is clearly you can see the pituitary gland over here. Okay, that's the sphenoid sinus, that's the temporal lobe of the brain, that's the cavernous sinus above. So this is the cavernous sinus entirely. Okay, so yeah, that's the sphenoid, that's the cavernous. You can see the pituitary gland very clearly. You can see this is the third ventricle. Okay, that's the lateral ventricle, that's the third ventricle. You can see over here it's a pituitary gland. You can see the pituitary stalk, you can see over here very clearly. So once you have sure and confirmed that you are in the at the level of the third ventricle and the pituitary gland. You can see clearly that's the pituitary gland over here, that's the cavernous sinus, that's the carotid artery, internal carotid artery in the cavernous sinus. So pituitary gland, pituitary stalk, the inferior intercavernous sinus, the superior intercavernous sinus, the lateral cavernous sinus. And always remember, you will see the carotid artery as two flow voids on the cavernous sinus MRI scan. Always remember, this is the optic chiasm over here. Okay, so once you locate the sphenoid sinus, you locate the pituitary gland, you locate the optic chiasm, because the division and the termination of the ICA into MCA and the ACA depends upon the level of the optic chiasm and the optic nerve. You can see this is the internal carotid, this is the internal carotid artery, two flow voids. See, as you can see, it is a post contrast or it is a T2. Now this scan is a T2 scan. Still the vessels are not appearing as illuminant because it is not a non-superimposed scan. So because of the high blood flow velocity, you cannot see the illumination in the vessels. So this is the internal carotid artery in the cavernous part. You can see now why do you see these two holes as two black voids? Now I've shown you the figure right here. As you can see over here, this is the thing. See, this is the first posterior genu, that's the second anterior genu. So if you take a cut section on a coronal section, you will cut this artery in a coronal section. You will see one opening here, you will see one opening here. So these are the two flow voids of which you see on the MRI scan. So that's a very simple logic. So that's the very same carotid artery, that's the posterior genu, that's the anterior genu, and that's the cavernous sinus. So this is the internal carotid artery, and that's the optic nerve. You can see optic chiasm, that's the optic chiasm. Now look at this internal carotid artery. Keep looking. You can see this is the internal carotid artery, and then dividing into something. You can see over here, this is the origin of the supraclinoidal and the ophthalmic segment, and eventually this will terminate into the ACA and the MCA right there. Okay, that's the basilar artery of the posterior circular villus. So this was the internal carotid artery of the sphenoid sinus, and then you can see actually the division of the MCA and the ACA. Okay, and this is the MCA, this is the ACA, and you can actually see the ACOM over there. Okay, you can see the ACOM as well, that's the division. So you need to learn, you need to practice, you need to sit with a radiologist to confirm the findings which you have on the CT scan and the MRI, so that you become very expert as a surgeon to read all the scans. You can see all this, these are the branches of the MCA, these are the branches of the MCA. Then this is very much posterior, that's the basilar artery, superior cerebellar, posterior cerebral, and all. So this is how you definitely try to locate the anterior and the middle cerebral artery on an MRI scan as well. So you need to understand the basics. Okay, so this was the MRI part where you can locate the internal carotid artery on the MRI. Now moving on to further, this is a CT scan. Okay, now moving on to the CT scan. This is a CT scan. Now if you order a normal CT PNS or a normal CT neck without any contrast, you are not gonna visualize any artery. So how you can see the artery is like this. As I said in my previous video, you can check in the list about how to read a CT scan for exam spotters, in which I have mentioned this is the anterior clinoid process, right? This is not much clear in the scan, so I'll show you one more scan over here. Okay, so I showed you how you can actually see the anterior clinoid process over here. See, this is the anterior clinoid process right here, and this was the optic nerve impression, and this is the internal carotid artery impression, and that was the cavernous sinus. So you cannot localize the internal carotid artery on a normal non-contrast CT scan, because it is going to appear as very much diffuse in nature. So you cannot actually localize the carotid artery itself. So you need to go for a contrast enhanced CT scan. So similarly, the way you saw the MRI, the same way you will see the carotid artery in the CT scan, okay, which is a contrast enhanced CT scan. So, and that too offers soft tissue window, because if you ask for a bony window, you will not able to get it. So you need to ask for a post contrast CECT neck and PNS with a soft tissue window. Okay, so that is how you can locate on a CT scan post contrast. But also I need to show you how you can locate the artery on a CT angio, right? So we've covered the 3 points. We've covered the clinical and surgical anatomy, the arteriography, the MR appearance, and now we are going to see the appearance of the CT angio. Now, this is a picture which I've taken from the application. So as you can see over here, which I'll show you this first. This was the internal carotid artery, the turns. This is a termination of the internal carotid artery into the MCA and the 2 ACAs. Okay, so this is how it actually looks like on a CT angio. So if you are having a radiant DICOM application, you can actually rotate that in 360 degrees. So this is how a CT angiography looks like. So you can assess the actual length of the CT scan internal carotid artery. So this is the subclavian artery over here. That's the subclavian artery. It is kind of looking very bright because of the contrast right here. So this is the subclavian artery over here. I'll just zoom in this for you guys. So as you can see over here, that's the subclavian artery. That's the common carotid artery, the right side. That's the left side. So as you can see, that's the cervical part. Then it becomes the petrous part. Then the foramen laceral part. Then the cavernous part. This is the cavernous part. And then this is the supraclinoidal, and then terminates into the MCA, and this is the ACA, and that's the ACOM. So you can see this is the ACA, anterior cerebral, that's the middle cerebral, and that's the terminal part of the ICA, that's the C7. That's the ophthalmic segment. You can see a branch, a faint branch, and that's the, so two branches which you can see is the superior hypophyseal artery and the ophthalmic artery arising from that segment. So, and you can see this is a vertebral artery there, the branch of the subclavian artery arising to form the basilar artery. Then this is the superior cerebellar artery, and this is the posterior cerebral, then the posterior communicating, which will form the circle of Willis. So this is how actually the entire internal carotid artery system is studied for any clinical applications like arteriography. You can use this to locate for any plaque, any atherosclerosis, any luminal narrowing, for transient ischemic attacks, for stroke, to locate the area of stenosis, for embolism. You can use all these applications for this uses. So also this is another variant of the angiography. So you can see actually the same thing but on a different contrast level. So you can see over here, you can see the arrow is pointing out to the luminal narrowing of the basilar artery. You can actually see the luminal narrowing of the basilar artery right there. So similarly on the lateral aspect, you can see this is a vertebral artery, the basilar artery. You can see there is a luminal narrowing of the basilar artery, and that's the internal carotid artery, the ACA and the MCA, and the pericallosal and the callosomarginal branches. Also, one point to note on the normal CT scan axial is that you can see the carotid canal, actually the part of the ICA within the petrous part of temporal bone. And that's the temporal bone right there. That's the mastoid air cells. That's the petrous apex region right there. So you can see the carotid artery running in this carotid canal within the petrous part. So if there's any lesion, as you can see over here, there is a lesion in the petrous apex. Actually, it is a cholesterol granuloma of the petrous apex. You can see how the petrous apex lesion is compressing on the carotid artery over here. That's the petrous part of the internal carotid artery, which is almost at the level of foramen lacerum over here. So this is how you need to know, clear your basics in the radiological field as well, to know which lesion is affecting the carotid artery and to what degree. So if a skull base surgeon is also operating on a case of a pituitary tumor, macroadenoma, or a craniopharyngioma, the most of the times the tumor will displace the internal carotid artery in its A1, A2, and MCA segments. So we need to be very careful on the MRI scan reading, and we have to get the details straight. So I hope these are the 4 points I have tried to mention for the internal carotid artery. If you have any doubts regarding anything which you saw in the video, please post your comments in the comment section. I will get back to your comments as soon as possible and clear all of your doubts. Now, any videos you want in the future, just leave me a comment in the comment section, and I'll be definitely helping you guys for your exams and stuff like that. So I hope this video helped you a lot, and until then, next time, thank you so much. Keep subscribing, keep liking the videos so I can post more videos to help out you guys. Okay, thank you.